Hello dear students, so today we are going to complete the antiarrhythmic drugs. Now we are going to treat the antiarrhythmias. You know there is one scientist known as Vaughan William classified the antiarrhythmic drugs into four classes. Class 1 is sodium channel blocker. Class 2 is beta blockers. Class 3 is potassium channel blocker. And the class 4 is calcium channel blockers. Okay. So this is the Vaughan William, which is classified into the four classes. Okay. Now we start with the class 1 drugs. You know class 1 drugs, I told you that it is the sodium channel blockers. In class 1 drugs, there are further classifications. Class 1 drugs are further classified into class 1A, 1B and 1C based on the domination of the action on the sodium channel. Means how much sodium they are going to block and how much is the association of the sodium and dissociation of the sodium channel with these drugs. Now, before understanding the class 1 drugs, let me tell you something about the sodium channels. You know, sodium channel exist in three states. Number one is the open state, that is your zero phase, when sodium channel rush inside that. This is activated sodium channel, zero phase because of activation, because of open channel. That time your sodium channel is open. Okay. There is inactivated phase when it reaches to the plus 40 here, then it becomes inactivated, or we can say in a refractory period, refractory phase. That sodium channel is in inactivated. Sodium channel is at where when it starts opening the potassium channel for a brief time, that there, and when it is going to again put the cell in a resting phase, there is also a stage, we can say inactivated sodium channels are, there are refractory sodium channels, that is at position number 1 or at position number in intersection of 4th and 3 of the action potential. Okay. Now number 3rd stage is your resting membrane. Number 1 is open and number 2nd is inactivated state and number 3rd is resting sodium channel state. It is the states, these are the states of the sodium channels. Okay. Now coming to the 1A, this is your 1A action potential. Okay. Dotted blue line is the action of 1A drug. Okay. You know, in 1A drug, what is going to happen? See, this is your zero phase. We can say it moderately slows the sodium channel in the open state, and one thing more, that it blocks the sodium channel in a frequency or use dependent. What does that mean? That means when your heartbeat is more, the frequency of attaching, frequency of these drugs to get attached is more. And when your heart rate is less or when your beat is less, then it is going to attach with the sodium channel less. That we can say it is a use dependent blockade. Okay, this is your that it moderately slows the zero phase. Moderately, see, it moderately slows the zero phase. It binds to the open sodium channel. Okay, open state of the sodium channel. And in the late stage we can say it also bind. It is also having a binding with the potassium channels. It also bind with the potassium channel. So what is going to happen? So that means it is going to prolong the that action potential duration. It is going to prolong the action potential duration, as well as it is going to prolong the effective refractory period. You know, this is your effective refractory period. See, it is prolonged here. This is prolonged effective refractory period. So two things: it moderately slows zero phase, it prolongs the action potential duration, as well as it effective refractory period. Okay. Its association with the sodium channel, as well as the dissociation is moderate. Okay, that means it moderately binds with the, and when the premature beat is not there, then it dissociates very quickly. Okay, now it also blocks the L-type sodium channel. See, if you here, this zero phase is because of L-type sodium channel, L-type calcium channels. So in high concentration, if you are giving high concentration of these class 1A drugs, it is going to bind with the L-type calcium channel also, so decreasing the slope in that conducting cells also. Now let me tell you that what are the examples in the class 1A drugs. Number one is the quinidine. Okay. Number second is the procainamide. Number third is the disopyramide. You know disopyramide, it is having anticholinergic activity also. Okay. This is one. Now coming to the class 1B drugs. Class 1B drugs, see, it marginally deflected the curve. Marginally deflected the zero phase. So that bit it is having, it blocks, and number second, it blocks the inactivated, that means it bind with the inactivated sodium channel. Okay. It also decreases the this potassium channel, so it is not having potassium channel blocking activity. So we can say it marginally slow down the zero phase, number one. Number second, it shortens the action potential duration. Okay, and it blocks the inactivated state of the sodium channel. Okay, or we can say preferably inactivated state. It can also bind to the over. The good thing is that it quickly associate and dissociate with the sodium channel. These drugs quickly associate with the sodium channel in the refractory period very quickly. Okay. Now see, we can say it shortens the ERP. When it shortens the ERP, that means your action potential duration also shortens. Okay. Now coming to the third, class 1C drugs. Class 1C drugs, see, it markedly slows the zero phase. See how much it decreases the slope of the zero phase, but it is not heavy. It does not affect any effective refractory period. Okay, that means we can say it markedly slows the zero phase. When it slows the zero phase, that means depolarization will be slowed down, and it marginally affect the action potential. That means it is having marginal effect on the effective refractory period and action potential duration. So in the class 1B examples are lidocaine, maxilitine, tokenide, phenytoin, eprinidine. Okay, whereas the examples of this 1C drugs are flecainide, propafenone, moxizine, ecanide, and indiecanide. Okay, indiecanide. Okay, these are examples of this. Now coming to the class 2 drugs. Class 2 drugs means, see, it is the sympathetic nervous system. which increases the heart rate and which increases the contraction of the heart. That means the class 2 drugs, what they are going to do, they are beta blockers. That means they are going to cut down the sympathetic action on the heart. So what is the sympathetic action on the heart? It increases the heart rate and increases the heartbeat. So these class 2 drugs decreases, that means beta blockers decreases the heart rate and it decreases the contractility. Okay. So class 2 drugs, which is associated with the sympathetic nervous system. Okay. The examples are propranolol, atenolol, esmolol, sotalol, timolol, carazole, and bisoprolol. You know, this esmolol, it's having very short half-life. That means it is giving IV for treatment of the arrhythmia. It is given IV because it's having short half-life, and it is the best beta blockers which is given in the emergency case of the antiarrhythmias. Okay, as antiarrhythmia. So it is given IV. Now this is class 2. Coming to the class 3 drugs. Class 3 drugs include the potassium channel blockers. See, potassium channel, when it blocks, it does not have any effect on the 0 phase or 1 or 2 phase. That means it is the 3rd phase which is going to increase. When 3rd phase is increased, that means action potential duration gets increased. Yeah, we can say effective refractory period get increased. So when the effective refractory period got increased, that means action potential is also increased. That means premature beat will not occur. So the example, that means it prolongs the phase 3. It is having no effect on 0 phase, and it markedly increases the action potential ERP, that is effective refractory period and action potential duration. The examples are amiodarone, dronedarone, brutalium, bunaftine, ibutalide, and neficalant. Okay. Now coming to the class 4 drug. You know what is class 4 drug? It is the calcium channel blocker. So you know they are going to inhibit the calcium at the plateau phase. That means there will be no plateau phase. There is increase. So when there is, that means there is flattened phase 2. So if there is flattened phase 2, that means it slows the conduction at the AV node. How it slows the conduction after? If it going to block the 0 phase, L-type calcium channel, they are also going to block that. That means it decreases the slope there for the 0 phase. When it decreases the slope, so firing rate from the SA node to the AV node decreases. So it decreases the conduction towards the AV node. When it decreases the conduction, that means it decreases the arrhythmia condition. Okay. So in nutshell, these all drugs, the classic, the sodium channel blocker, beta blockers, potassium channel blockers, or calcium channel blockers, they are going to set right the arrhythmias which occur because of the fluctuation, or which is going to occur because of the premature beat, or we can say there occurs the disproportionate exclusion and inclusion of the ions. So in order to set those things right, we are using these classification. Now there is one more classification. We can say there is 5th classification, class 5th drugs. Class 5th drugs include your digoxin. You know that digoxin, what is going to do because of its vagolytic action, it is going to suppress the activity of the conduction of these impulse from the AV node. You also know that because it is having sympathetic, parasympathetic action, vagotonic action. Because of the vagotonic action, these drugs are used for supraventricular tachycardias. Okay, all other drugs are mostly used for ventricular tachycardias. Okay, now number second is your adenosine. Adenosine, what adenosine is going to do? It is going to increase the rate of this potassium channel exclusion from the cell. If there is increase in the potassium channel, that means your cell will remain. It requires more ions to stimulate the cell to reach the threshold. That means when there is exclusion of the potassium channels ion, that means you are increasing the electronegativity. When you are increasing the electronegativity, that means you are keeping your cell in a more refractory state, so that if premature beat will come, it is in the refractory state, it cannot going to activate the cell. Okay, this is the adenosine. Number third is, there is one more, that is known as magnesium sulfate. Magnesium sulfate, it is having, but the mechanism of action is unknown, but it is having anti-arrhythmic action. Okay, now